Hello, can you hear me? Welcome to a brand new podcast, giving voice to the diverse talent working to improve health and care for people in West Yorkshire and Harrogate, presented by our Black, Asian and Minority Ethnic Talent Network. Our pilot episode was presented by network member Fatima Khan-Shah, programme lead for both Unpaid Carers and Personalised Care at West Yorkshire and Harrogate Health and Care Partnership. She was joined by some fantastic people to get this series underway. We want to thank all of them for giving up their time to come and chat with us. They met up to talk by video conference on Thursday the 7th of May 2020 to answer questions and discuss our episode topic, everything you wanted to know about the coronavirus but were afraid to ask.
Just in case you've not heard of each other, would it be helpful to do a few brief introductions? Yeah. Yvonne, would you like to kick off?
Thank you. Thank you very much. I'm Yvonne Coghill. I'm the Director of the Workforce Race Equality Standard, and I'm also Deputy President of the Royal College of Nursing.
My name is Habib, and I'm the Deputy Director for the Workforce Race Equality Standard at NHS England and NHS Improvement.
I'm Nyoka Fothergill. I'm Service Manager at Leeds Social Care.
Hello, my name is Sal Uka. I am a consultant in paediatrics at Coaldale and Huddersfield NHS Foundation Trust and the medical lead for the West Yorkshire Association of Acute Trusts.
Thank you. So I think it's an absolutely wonderful opportunity for us to come together and have a very honest conversation about the impact of COVID-19 and the various experiences of our different communities here in West Yorkshire and Harrogate, but particularly focusing on our BAME staff as well as our communities. So, everything you wanted to know about the coronavirus, but were too afraid to ask. And our panel is fearless when it comes to this. We're ready to take on any question, aren't we, guys? And the first one from our BAME network is, can you tell us what we know so far about the impact of COVID-19 on Black, Asian and minority ethnic people? I think it would be helpful maybe to start with a national perspective and then go down to a regional one, if that's comfortable with you all.
Yeah.
I think this is a really important subject for us. It's very topical and is critical actually for us. But what we know is that the coronavirus doesn't discriminate, but people's experiences, their circumstances and their situations do. So what we've learned over, I guess, the recent period is that there is an impact in terms of different factors such as age, comorbidity, of geographical location, of how people live in terms of multi-generational households. But there is also a key element here that we're missing, and that is, where do Black and minority ethnic staff find themselves in terms of the workplace? And there's a key element here, which I'm sure Yvonne will kind of touch upon, which is around biological weathering and the stressors that people kind of experience on a day-to-day basis.
Yvonne, that was a really, really helpful summation from Habib. Have you got anything you wanted to add to that, particularly about his point regarding weathering?
Yeah, I guess, all of you will have had the opportunity by now to have read the Office of National Statistics report that came out this morning at 9:30. And I've been fortunate enough to be able to inwardly digest it throughout the day. And it is, as Habib has described, if you are from a Black and ethnic minority background, you are more likely to die of COVID-19 than if you're from a white background. Fact. Another fact is that the Office of National Statistics took into account the socioeconomic situations that people are in. It took into account the class that people are from. It took into account all the things that people are saying that might be a cause of the fact that Black and ethnic minority people are dying from this disease. And when they took those factors into consideration, Black and ethnic minority people are still twice as likely 1.9 for black people, 1.8 for people from Asian backgrounds to die than white people. So what the report says is that there are other factors that might be at play. And one of those other factors is allostatic load. We know that actually the more stressed you are, your body doesn't react as well as it could do if it is constantly stressed. We know that black and ethnic minority people live in much more stressful environments than white people. They have to put up with much more in terms of the hostile environment. They are less likely to get the jobs they want, the education that they want, and where they want to be and where they want to live. So they're living with much more stress than their white counterparts. And the evidence shows that as a consequence of that, their lives are shortened. So they have these things called telomeres, and what the telomeres are sitting at the end of your chromosomes, and they're shortened. And as a consequence of that, you live your life as we do as black people in a normal way. But our age doesn't just capture the length of time we've been alive, it captures the experiences you have in that time. And if you have difficult, hard experiences constantly raining down on you, it means that you are going to be more susceptible to any kind of illness. We know that black and ethnic minority women in this country are more likely to die in childbirth. We know that we're more likely to have diabetes, heart disease, and people talk about the foods that we eat, and they talk about where we live, and they talk about all of that. But what they don't talk about is how the constant stress of living in a white-dominated society, which isn't built and designed for black and ethnic minority people, impact on us and actually damage our health.
And it's fascinating that, isn't it? Because I don't think many people from BAME backgrounds, never mind non-BAME backgrounds, kind of fully appreciate that impact, that accumulative impact over time, and its impact on our health and well-being as well, just by going through our day-to-day lives. Sal, can you give us a bit of a perspective from your experience in West Yorkshire and Harrogate, particularly from the acute trusts? What is the data telling us at the moment?
The data is fairly limited at the moment, in all honesty, in terms of what we have across West Yorkshire and Harrogate. Interestingly, there was a very small scale study done in Bradford, but it was very specifically looking at the South Asian population within Bradford and those that were being admitted to Bradford teaching hospitals. And they didn't find a difference with their data. Now, the numbers were small. And I think this was also very early on when some of the patterns started to emerge around ethnicity and the increased risks, both in terms of developing COVID-19 and also, unfortunately, dying from it too. So the point that I'm making is it's a changing picture, and actually what we're getting is different data at different times, which I think which will change how we manage it forward.
Thanks, Sal. That's really helpful. And I think, one of the things that we need to be mindful of in the situation like this is that, the intelligence is changing every single day. It's a moving, fast-paced situation, and people are trying their best to try and understand the different indicators and what that could mean and what's causing it. So obviously, this is an ongoing process, and there are also other bits of research and work taking place in the region as well as nationally to understand what the data is telling us and the causation of that. So that's really, really helpful.
What I would add, though, is that there is a commitment through, so for colleagues that are listening through the West Yorkshire and Harrogate sort of footprint, there is a commitment to actually sharing this data. And I think that probably is one of the first hurdles that we have to address here, especially when we look at the ONS data is obviously, there's a lag with that. And that sometimes obviously then adds the delay of getting some of the results out. But actually, there is a commitment from all acute sector trusts to provide this data, so it's a bit more real time, which should hope for better sort of analysis and quicker results.
You're listening to Can You Hear Me? The West Yorkshire and Harrogate Health and Care Partnership BAME Network podcast.
One of the most important things that we're hearing, particularly from our BAME network colleagues, is a question about if you are from a BAME background, and you do want to go to work, how do you keep yourself safe? What would be your sort of top tips or advice?
I can offer something there, Fatia.
Thank you.
From a social care perspective, obviously a lot of our staff are on the front line in terms of social work or working for care providers. So really, in terms of keeping yourself safe, there's lots of guidance around PPE. One of the difficulties is obviously that guidance is changing regularly and often, and lots of anxiety from staff, especially from BAME backgrounds, about what that means for them, especially if they're delivering things like personal care in the home and coming into direct contact. So certainly where I work, it's an ongoing conversation. And I think the important thing is to make sure that we're listening to these anxieties or the concerns that staff have, but also making sure that they're equipped and understand how they protect themselves when they're out there on the front line in terms of the PPE that's available to them.
Absolutely. And we know that particularly from the social care sector, that has been something that they've been quite anxious about, haven't they? Habib, from a sort of national NHS England improvement perspective, what advice would you give to particularly our BAME colleagues here that are quite anxious about whether it's safe?
Yeah, I think there are 3 points. Firstly, I think we need to look towards the governmental guidance relating to social distancing at any current period of time, and that's absolutely important. At the moment, that's around protecting our NHS and protecting people and saving lives. I think secondly, we need to look towards organisational guidance from the workplace around whether going into the office is right or whether people can work from home. And then I think there's a third element around this, which is kind of related to individual circumstances, and that's around shielding those that are at most risk, particularly if somebody lives within multi-generational households. So with elderly relatives. So that's really important as well. So I think those 3 points, probably in that kind of order. So the governmental guidelines, understanding what the workplace is kind of putting out in terms of guidance, but also looking at your own personal circumstances in relation to those 2 points as well.
And we do know, for example, Sal, in West Yorkshire and Harrogate, that many of our organisations are having conversations and doing risk assessments on a case-by-case basis to make sure that our employees are safe, as well as what we can to support our communities. Is there anything that you want to add about the work of WYAT in that particular area?
I think the answer's in the question, if I'm honest. I think when you say case by case, I think that there's a danger about applying a blanket policy, if you will, or a blanket approach. And I think, each person, depending on their role, depending on their own personal risk factors, I think Habib made reference to their own personal circumstances. And I think what is really important is that would empower those people who are listening to this podcast to actually think, what's important to me? The title of this podcast is very much about, do we see people as individuals? And actually, that has to be an individual assessment of, if you will, risk, but also an individual assessment about, well, actually, what do I do? What is my role? How do I contribute? What does my job, my paid job, if you will, but also my kind of contribution to society in a bigger sense be? What does that mean to me? Because actually, as a doctor, I'd find it really difficult not to be there, say, on the front line with colleagues if I felt that's what I wanted to do. But it's also about making sure that I'm being safe, and that's where the role of PPE comes in, and ensuring that that I'm using PPE appropriately and within guidance.
And sort of as staff, if we're in a position where we're feeling that we're being put in at unnecessary risk, are we in a position to challenge our managers? I mean, what does the guidance say, Habib, in regards to that particular situation, and what would you advise staff in that position?
I think it's critical to understand the fact that we need to support our staff. We need to listen to our staff. Staff need to feel as though they have that psychologically safe space to speak up. But equally, our organisations need to be ready to listen up as well. We within NHS England and NHS Improvement, as part of the Workforce Race Equality Standard team, are working very closely with the Freedom to Speak Up Guardian's office to make sure that we can create those psychologically safe spaces for people to speak up. And that's absolutely, important, because if we don't care for our staff, then our staff will be less supported to care for our patients. So that point, Fatima, is absolutely critical that we get right.
And is there a particular role for BAME networks, Yvonne, in how we can support our staff in that particular situation as well, do you think?
Absolutely. I mean, Habib's 100% right there. We have a responsibility to support all of our staff and to make sure that they are all safe. It's very clear from the letter that Simon Stevens wrote that, we have a duty to make sure that we risk assess our staff. We know now, as a consequence of this report that came out today, that is something that all organisations must do. And I understand the national guidance on risk assessments going out later on this afternoon, if not this afternoon, tomorrow, because it's so critical and so essential. And I believe that staff who do not feel safe, and I'm saying this with my RCN hat on, really, really must seek the help and support of either their manager and or their union, because this thing is serious. We're not messing around here. This is about people's lives. It's about their families' lives. It's about everything that they're about. And if they do not feel safe going into work and facing COVID, and not feeling protected, then actually they really do need to speak up and do something about that, for sure, without a doubt.
Yeah, you're absolutely right. I mean, the data is very, very telling. Sal, did you want to come in on that point?
I agree wholeheartedly with what Yvonne and Habib have both said, because I think that this isn't about anything more simple and important than our lives and the lives of the people that we care about, and I think that's fact. What I do worry about, though, is where perhaps people feel as if they're raising concerns and they're falling onto deaf ears. That is a real worry. And we know that prior to COVID-19, issues related to BAME staff have at times fallen on deaf ears. Now, I don't say that with any kind of sense of pride, because that is frustrating. And I worry about individuals who are working in smaller teams or in small organisations who don't feel as if they have the network or the support that they feel they should get. What I would be saying to those colleagues, especially those colleagues that are listening to the podcast across West Yorkshire and Harrogate, is come through to the BAME network within the ICS, because actually, although the BAME network, Fatima, that yourself, myself and other colleagues are involved with, are there to kind of coordinate a slightly more strategic approach, if you will, to issues across the system, we are also there for individuals if they need to. So I think don't ever fear about knocking on doors. If you're not getting the answer you require, there's another door that you should knock on.
I mean, you make a really good point, Sal. Nyoka, did you want to come in on that point?
Yeah, I would say I think it's a really valuable point, and the fact that we have a BAME network in the council as well, that I think it'd be really good to kind of link up and see what information you guys put together and to try and share that learning and the information and the guidance so it goes out across all of the networks, so we can kind of consistently give everybody the same message and raise the key messages as well, with that offer of support as well if people want to have any additional support.
I mean, the point Sal made about the res data, for example, I think is really important, because particularly it had shown previously that BAME staff had, they experienced greater discrimination and bullying. How can we use COVID-19 to highlight the work of BAME colleagues and key workers to change this? And I'm sort of looking towards Habib, particularly in Yvonne, with your work in the res and the recent guidance that you've both been instrumental in really getting this agenda front and centre now. Does this mean change?
I think from my perspective, we don't need to use COVID-19 to spark further work or to turbo boost our work, because in a way, COVID-19 has already done that for us. So we've got the data, we know what the evidence is. The fact is that the NHS has a brilliant workforce, which comes from different backgrounds from all over the world. And of course, this includes, those people that are currently at the forefront of tackling the coronavirus response on behalf of the NHS. And these are people that are amongst the nation's heroes, and we must support these people. These are our NHS people, and we know through the work of the RES that black and minority ethnic staff, have poorer experiences, are less likely to be supported in the workplace. We've got all those statistics. What we need to do when we kind of go into the new normal after the virus period is to make sure that equality, diversity and inclusion and race equality in particular is at the heart of what we do going forward.
Absolutely. Yeah. And Yvonne, is there anything that you wanted to add to that, particularly in regards to sort of the work that you guys have been doing recently with Simon? You mentioned Simon's letter and the recent guidance that's come out. Do you think that will really support things and make change happen?
Do you know what? I keep on hearing people say things need to go back to normal. I'm really anxious for things to go back to normal. Normal for 20% of the workforce in our NHS was pretty rubbish, actually, wasn't it? Let's tell the truth. The RES data actually shows that, if you're from a BME background, you're going to have a worse experience in the NHS than your white counterpart. So here's the thing. We now know, without a shadow of a doubt, that black and ethnic minority people have died as a consequence of COVID. We also know some of the reasons for that. And I've already explained what allostatic load is in terms of biological weathering, which black and ethnic minority people have to tolerate. Now think about this and make the link. If you're a black and ethnic minority person working in the NHS and you know that you're not likely to get a job, you know that you are, more likely to be disciplined and on and on and on. Surely, to goodness, everybody now knows that your stress levels are going to be higher and that you potentially are more likely to become sick than your white counterparts. It's out there. The data is there. So there's nowhere to go with, we need more data or a bit more research or whatever it is that people are saying. So actually, what has to happen now is we have to have some serious demonstrable change from our top leaders. And, I, for one, I suppose it's probably my age and the fact that I've been around a long time, will be saying that to them. Because actually, if you don't change, people will continue to die. And that's not acceptable. And people think it's, oh, God, my goodness, she's really, really speaking very strongly here. It's as serious as that. There's nothing more serious than your life and the life of your families. So unless people in the NHS or at senior levels grasp this by the nettle or the metal, whatever it is they call it, it is going to be the same. And I'm hoping and I'm praying that it won't be, that they will actually start to do what they need to do to make things better for black and ethnic minority staff in their organisations. We haven't got two NHSs with big black folk over here and white folk over there, and they get a nice deal and we get a poor deal. All of us are in this together, so we're told. Subsequently, all of us should be treated fairly, equitably and well.
You're listening to Can You Hear Me? The West Yorkshire and Harrogate Health and Care Partnership AIM Network podcast.
Is there a new way in which we could potentially utilise this new reset, NHS Renaissance, whatever you want to call it, to readdress this inequality and the scale that some of our communities are facing when it comes to poorer health outcomes? Is there something that we can do together? Is there something we can do to highlight this even more and really get that transformational change that has been highlighted by COVID?
There is something here about working together. So we have a choice. We can either be bystanders to this agenda, or we can come together and tackle the root causes of the inequality. And the integrated care systems provide us with a unique opportunity of coming together to bring people together, to bring organizations together in order to tackle those root causes. But the critical point is that these inequalities need to be addressed not just by words, but by deeds and by action.
Absolutely.
And so we need to focus on leadership on this agenda. We need to come together, not just leaders, but also middle management and every layer of the NHS to focus on those root causes and to work together on this agenda.
Yeah, I agree with Habib. I think is that there is definitely an opportunity for ICSs to do something. I mean, and I guess my glass is always half empty. I mean, I've been in the NHS for 42 years and I'm working on this agenda for 20. So the optimist amongst us is Habib. He's the one who is, very positive and all the rest of it about the change and all the rest of it. I'm hopeful. I mean, I hope that, as a consequence of this, we're going to see some different behaviours from our senior leaders. Because, we travel up and down the country, we're talking to people on boards and all the rest of it, and they're very nice to us, welcome us in, give us a cup of tea and a biscuit and say to us, yes, we understand the res data. And then it all goes back to normal, which is everything stays the same in their organisation. So now we can't go up and down the country anymore. And I suspect we're not going to be able to do that for quite some time now. And what has to happen is that they have to step up. I remember a neonatologist, a friend of mine, saying, I'm a neonatologist and I look after babies. I don't look after its arm or its head or just its leg. I have to look after the whole. If you're a chief executive or a senior leader, your responsibility is to look after all of your workforce and to make sure that all of your workforce is given not just equal opportunities, but a fair crack of the whip. So they have to change. Now, if they're not prepared to change or not willing to change, or don't want to change, I would go as far as to say it's time to, ship out. If you're not going to do what you need to do, go somewhere else and do it. And I seriously mean that, because this is people's lives. We're no longer saying this is data and we need more research and we need this and we need that. We've got the evidence of dead people in our NHS. I cannot stress it enough. And I know that people pussyfoot around all of this stuff, but no more, not for me anyway. It is about making sure that we have the leadership that we need so that our staff are safe. Our staff are able to do what they need to do and thrive in an environment that is conducive and rewarding and makes them feel valued and appreciated, as opposed to the opposite. So yes, leadership has to change. See, Habib's the voice of reason.
Always the voice of reason. But I think you alluded to, Yvonne, is a really important point, which is, the health of people isn't just based on, the interventions that the NHS makes. There are so many more factors, like where they live, where they work, their socioeconomic income. And, COVID has really brought to light that there are a number of people from those backgrounds that are not living happier, healthier lives because of the socioeconomic circumstances in which they're exposed to. But there's much more work to be done. And I think the introduction of integrated care systems gives us an opportunity as a system to work in a slightly different way and to intervene with the local authority in interventions like housing that are far more impactful.
I agree, and I think that my hope and my wish and my dream is that happens, that they actually do start to work differently. The NHS is a very process-driven organisation. We are into our process, and we do feelings are over there somewhere. And if you go into meetings with senior leaders, they want the strategy and they want the process and they want it this way and that way. And actually, this is you're absolutely right. This is more important than that. This is about how we change the way people view other people's lives. It is about empathy. And Michael West talks about empathy, listening, and that's the first thing, and understanding, and then, empathizing, and then acting. We're at the listening stage, aren't we? We want people to understand and then to empathize. And that's what those senior leaders need to actually start doing and thinking about now.
You're listening to Can You Hear Me? The West Yorkshire and Harrogate Health and Care Partnership BAME Network podcast.
What can the NHS and local authorities do to prevent a slide into greater inequalities for our populations, particularly as the data suggests that poorer communities and those most affected by COVID are most likely to be affected post-COVID as well? Habib, did you want to come in on that?
Yeah, I think, Fatima, on the back of Yvonne's response, I think engagement with our communities is absolutely critical. But not just engagement as a tick box exercise. I think engagement needs to be both sustained and it needs to be meaningful as well. And alongside that, of course, co-production is essential, because if we start to change the experience of people in the conversation, and we start to shift that conversation, in the totality. So we need to really have that engagement, but not episodic. It needs to be sustained and it needs to be meaningful.
Absolutely. And there's something about how we design and commission services that are meeting the needs of our communities. There's no point designing something which a certain cohort of our community won't be able to use and doesn't meet their needs. It just doesn't make sense, does it? Nyoka, do you want to talk a little bit about what's going on in Leeds, and particularly the work that you're leading on in social care?
Yeah, in Leeds, we're leading on an approach called strength-based social care. So the principle is to focus on what's strong rather than what's wrong. And we've kind of stripped back the whole assessment process, and it's more about having a conversation. So we're trying to get rid of words like referral and assessment and strip out all the difficulty around those types of processes and just engage with people and have conversations at a local level. And part of that is also linking into communities, so the community-led support. And that's kind of working at a local level. So our local social work teams are working with their local communities and harnessing all the support around the third sector and everything around that locality to just really look at what the population in those localities need and trying to link in with them where they've already got their own strengths, they're already doing things within their own communities, but how can we actually harness some of that and support them to build it? In terms of meeting some of those cultural needs at a local level as well.
And there's something that you've talked about which really resonated with me, which is how do we empower ourselves or our peers to take ownership of their health and well-being and have that kind of can-do approach rather than doing unto them, which I think is how we've tended to operate for quite a while. And again, from if you're looking at the health inequalities or the communities that are at the adverse end of this spectrum, it's mainly because they haven't had the skills or the expertise to do that, and they're crying out for it. I mean, Sal, from an acute trust perspective, what are your thoughts about how we can deliver services differently in the new NHS reset world? I mean, I know that, for example, some of the services are exploring how they can start providing services in a different way post-COVID. Do you think there are areas of learning from what Nyoka's described about how we can empower people to think differently about their healthcare?
Do you know what? If I was to count up and get a quid for every time I've heard someone over the last few weeks, irrespective of their background and irrespective of whether they're working in health or in the care sector, describe the want to go back or not go back to what was normal, and take your pick between reset, recovery, new normal, whatever word you want to use. But essentially speaking, not go back. I probably wouldn't need to work for the rest of my life now. and I think, that's probably the one thing that I reckon anyone that works within health and care would agree on, that actually, do you know what, we don't want to go back. Not because it wasn't particularly broken in part, but actually, do you know, it just wasn't good enough. And actually, the way that BAME colleagues have, and especially in work, in health and care, it wasn't good enough. My worry really is, I think COVID-19 has been a real trigger for a number of really sort of deep questions, some of which we've already touched upon here today. And I think, the worry that I have is that this will get lost amongst some of the other stuff that we have to do or want to do. No, this we do in parallel with all that other stuff. And I think it's about change, a visible change, markers. Habib talked about conversations. Conversations are great, but conversations have to have an output. I recognise that that I am a BME leader and I have been a clinical leader for a number of years now. I haven't quite reached the heady heights of some of the colleagues on this, but it doesn't matter, because actually it's about understanding that actually I am a role model for some people. And this isn't just about what I do for myself and for my own career. It's about making a clear marker in the sand that actually, do you know what, there needs to be more leaders who are in positions that are sort of visible, who are role models, and who actually can show that actually we have the right level of representation. And I look at kind of what happens across West Yorkshire and Harrogate, and there will be a place for someone from the BME network to be there amongst the senior decision makers across West Yorkshire and Harrogate. And actually, do you know what? That's just one thing that needs to be done. There's a whole list of things that we will tackle.
Absolutely. And there's something about, diversity of leadership in every single forum of decision making. It's really, I can't emphasize enough some of the stories and some of the fears that we've heard during this time, particularly from BAME members of staff, who feel like decisions have been taken or are being made without, the influence and diversity of thought in the room. And we've seen some of the impacts within that. Did you want to come back in on that point?
Yeah, and I think the other thing that I would add is that, and I think, again, we have this grouping, don't we, of BAME. And actually, what we know that BME is just one of many protected characteristics. And I personally think that actually there's also more that needs to be done within the BME kind of subgroups, if you will. I think, especially for women are, who are of a BME background. We have three amazing women on this call so far today. But I don't think that is, again, representative, especially when you consider the workforce that we have within the health and care sector. Majority are, they are women. Especially in nursing, for example. So actually, why is that not reflected in senior leadership positions too? And I say that as a bloke. I am a bloke. So actually, I think there are pockets within our sort of our BAME, but also some of the other protected characteristics that also need to be borne in mind.
That's a really, really important point about learning from this experience. And what can we learn? What can we do differently? Particularly about how we try and empower our colleagues and our peers to be in a situation where they can reach the heights of those forums of decision making. So we're not in a situation where this is happening again. And I think Sal's point, Yvonne, about senior leadership, about nursing, as a woman that's been a role model to me for a very, very long time, and being in a position of authority and influence, there's clearly learning for us from your story about your journey into leadership and how you ended up where you are. Is there some top tip or golden nugget of wisdom that you could share with us about that?
I think the key thing, Chief Executive said to me a long time ago, there's a few things. First of all, make sure you get yourself some backstop. And when I say backstop, what I mean is that you get people behind you to support you, help you, nurture you, develop you, hold you. Because when the going gets tough, you soon see who your friends are. It's quickly how they disappear into the sunset when you're in trouble. And the ones that stay with you are the ones that you need to nurture and develop. So you really, really work hard at getting your backstop and making sure that it stacks up. That's one. The second thing that you need to do, I think, is to make sure that you are good to people, and nice to people. I mean, nice sounds like a really quite trite word, but when you're going up the ladder, you meet people, and if you're coming down, you meet those same people again. And if you're not decent, nice, kind, thoughtful to everybody on your journey, it will come back and bite you for sure, without a shadow in the doubt. So always be decent and nice to people if you possibly can be. I know it's tricky for people when they get stressed and all the rest of it, but it's absolutely key that happens. And thirdly, I suppose it's about keeping your credibility and keeping your authenticity. Keeping your authenticity is really key, because if you have to pretend to be something else and to be someone else, it becomes very stressful and very hard. So being your authentic self is absolutely key. Bringing your whole self to work, who you are, who I am as an African Caribbean woman, it's who I am, and I don't want to be anybody else. I don't want to, have to pretend to be anybody else. And I think that is absolutely key for all of us from those backgrounds. We have to be able to bring ourselves to work and be valued and appreciated for that.
I love it. I'm going to copyright that and make some really good money out of it. So that was brilliant. Nyoka, as a woman of influence yourself, who's managed to get through some of the highest stratas of power, what would be your 3 top tips to share with our female colleagues about how you did it? What was your secret?
Just picking up on what Yvonne said, I think from my own experience, somebody once said to me, "I'm one of your supporters." And at the time, I had no idea what he was referring to. And actually, it turned out to be one of the best managers I ever had. And I did really well career-wise because he just pushed and recognised my skills and experience. So definitely, I think it's really important to find people that can support you, empower you, and point you in the right direction, and sometimes nurture you as well. So that would be my kind of top tip. I think secondly, you do have to try and network and build up a network of a range of people and across agencies if you can, because it always helps just to have that wider circle in terms of your own development. And my third tip would be, like Yvonne says, bring yourself to work. Some people work in environments where you're marginalised, or there's not many other people that look like you when you kind of get there, and it's so important to kind of bring yourself to work and have your integrity in the work that you do, because you have to live with yourself at the end of the day. So I think really the staff networks, that's why they're brilliant in terms of people being able to have that connection and reach out and just share the same kind of experiences, speak to somebody who's going to really get it and understands where you're coming from, because they may have had a similar experience, and you might find out that they've also got lots of good tips for you too.
Golden nuggets, really. You mentioned, both of you, the importance of peer support and authenticity, and I think one of the themes that we've heard from colleagues during COVID is the importance of peer support, particularly when you're having to put your head above the parapet and say, I am concerned, I have these concerns, I'm very scared. Do you think that there's a role with other faith groups and community organisations as well to address these concerns? I'm going to start with Yvonne, because she's nodding at me going, yes, I agree.
Absolutely. I am fortunate enough to be leading on engagement and faith groups for NHSI and HSE. And, I cannot stress, and Habib will probably come in as well with this, how important it is to work with our faith groups. A lot of Black and ethnic minority people are really closely linked to their places of worship. And those places of worship they're also sanctuaries where people go and are looked after and nurtured, and they get their spiritual replenishment from those places. And we would be foolish not to actually see those places and work with those places of worship as somewhere that we can actually signpost our staff to in order to help and support them to recover from what they're going through at the moment, because what they're going through is unprecedented, and maybe the shock and so on hasn't hit people yet. We're expecting it to hit PTSD after the fact. So those places are absolutely key, and I'm sure Habib's got more to add to it than I have.
Yeah, no, I totally agree with Yvonne. I think what we need to remember is that our staff are also our community as well. And so we need to focus on the support mechanisms that we have, not just within the workplace, but outside of the workplace, particularly so, as Yvonne says, in terms of the rehab and recovery period after COVID-19, not just right now, but in the months and perhaps years to come as well. So they're absolutely critical to the NHS's response to COVID-19.
Absolutely. And Sal, do you want to sort of elaborate a little bit, particularly the role of chaplains, for example, within the hospitals, and the roles of, faith and community organisations and how they can support our staff as well?
I think the word here is community.
And
I think it can be very sort of flippant and used the word. And there are communities within communities within communities. And actually, it goes back to the point that both Yvonne that made earlier on about knowing yourself. It's about being yourself, and then actually, do you know what? Actually, it's what your values are. So actually, if you are a person of faith, I as it happens, I'm not. But if you were a person of faith, I know, and I've seen from others, that actually you seek and you gain a lot of comfort from faith. And actually, at times like now, when, let's face it, we're all a bit scared, I think actually seeking comfort from those with whom we can relate to is really, really important. I think there's also something else to be said about here, and this goes about the communities within community. The fantastic thing that we have seen, and it's almost like a warlike response in the wider community in its sense, is that actually, do you know what, we're all in this together. Someone very, very articulate said, COVID does not discriminate. And actually, without a shadow of a doubt, there's one thing that we can do here is actually be more aware, more tolerant, interested in communities within community. Because actually, at the end of the day, we will all stand together and we will come through this all together. It's about kind of saying, let's not make this just a moment in time. Let's keep it up. Let's speak to our neighbours, albeit through a 2-metre distance. Let's show an interest in their religions. Let's show an interest in their cultures, because that's how we learn and grow.
Absolutely. And on that very empowering message of we're all in this together, I think would be a good time to end this podcast. Thank you so much, Sal Uka, Yvonne Coghill, Habib Naqvi, and of course, Nyoka Fothergill.
Can you hear me now? You've been listening to the West Yorkshire and Harrogate Health and Care Partnership BAME Network podcast. Join us again next time, when we'll be joined by more diverse talent working to improve health and care for people in West Yorkshire and Harrogate.